Good afternoon or good evening, wherever you might be. My name is Kevin Michael Grace, and this is the Kevin Michael Grace Show. I'll start with a personal note. I will be able to do this show at least until the end of the week, but then, I have to find a place to live. So, as I say, we're good until Friday. So I thought that I would start with a discussion of what's the purpose of COVID-19, if it has a purpose. In other words, is the wholly unjustified panic surrounding this epidemic, is it the result of stupidity or malice? Reading from Wikipedia here, Hanlon's razor is an aphorism expressed in various ways, including never attribute to malice that which is adequately explained by stupidity. And the Wikipedia entry explains that several other people have said quite similar things, including William James, Robert Heinlein, Goethe, Jane West, Napoleon. So let's see. Let's start with Twitter. Twitter forces Laura Ingraham to delete post on chloroquine helping coronavirus patients. And VDare comments, safe to say the influence of China/Chinese propaganda on this platform is all but confirmed. Now, why would it be that Twitter would be intervening in a way that would be favorable to China? I mean, China wasn't looking very good coming out of the COVID-19 pandemic, but there is all manner of Chinese propaganda on Twitter, making wild claims that the United States created the virus in order to punish China. Well, I suppose this could be an example of what they call projection. First and foremost, a story from CNBC today, China coronavirus case numbers can't be compared to elsewhere, economist says. Economist Derek Scissors said it's hard to believe China's COVID-19 outbreak did not spread more significantly outside Hubei province. There's been no mass testing, which means the numbers should not be compared to the United States, where we are now doing late mass testing. Well, yes, this is the problem of the numerator and the denominator, and we do not have the denominator. Also, it is a bad idea to believe, to take at face value anything the Chinese government says on any subject whatsoever. Scissors, a resident scholar at the conservative think tank American Enterprise Institute, said the revelation that China is just now beginning to report asymptomatic cases more than 2 months after they applied a quarantine is a good sign of what the Chinese have been doing till now. Add to the fact that we know that the Chinese Communist Party is not honest about anything that's politically sensitive. U.S. officials, including Secretary of State Mike Pompeo, have also criticized China's lack of transparency around COVID-19. Independent researchers also previously criticized China for changing the way it classified confirmed cases. This kind of confusion breeds distrust. Eric Feigl-Ding, a global health economist at the Harvard Chan School of Public Health, told CNBC in February, you should stick to a standard even if you have caveats. Now, here is a story from Bloomberg. 3 days ago, confirmed coronavirus cases is an almost meaningless metric. Faye Flam writes, it doesn't matter that the United States surpassed China this week in reported COVID-19 cases because those numbers, 83,507 and 81,782 respectively as of March 26th, don't tell us how many people actually became infected in either country, nor do they tell us how fast the disease is spreading since only a tiny portion of population in the United States has been tested. The numbers are almost meaningless, said Steve Goodman, a professor of epidemiology at Stanford University. There's a huge reservoir of people who have mild cases and would not likely seek testing, he says. The rate of increase in positive results reflect a mixed up combination of increased testing rates and spread of the virus. With a population of 1.5 billion people, China's some 80,000 cases look like a rounding error, says Nigam Shah, an assistant professor of biomedical statistics at Stanford. And India's claim of some 754 cases probably reflects a severe lack of tests, not that the disease there is still so rare. The positive tests say little about how many are dying or will die, since most cases are mild. So it would seem that policy decisions have been made on the basis of, at best, sketchy data. Now, cui bono, who benefits? Well, I suppose it could be argued that China is the big winner, at least so far, out of the COVID-19 epidemic, because China has this disease, which originated in Wuhan, in Hubei province, has absolutely paralyzed the West and bids fair to wreck our economies. For how long? I don't know, maybe forever. I've mentioned before on this show that Nikita Khrushchev was absolutely appalled when he spoke to Mao Zedong in the late 1950s, and the discussion was nuclear war and its likely aftermaths. And Mao told Khrushchev that even if China lost 250 million people because of a nuclear exchange, that would still leave 500 million Chinese, and they would be just fine. I'm looking at a post from Zero Hedge, Chinese biological experiments to infect humans with coronavirus exposed in 2015 by Italian state media. And the original author is Guido Taietti from greatgameindia.com. 5 years ago, Italian state media-owned company RAI exposed dark efforts by China on viruses. The video, which was broadcast in November 2015, showed how Chinese scientists were doing biological experiments on a SARS-connected virus believed to be coronavirus derived from bats and mice, asking whether it was worth the risk in order to be able to modify the virus for compatibility with human organisms. Chinese scientists have created a pulmonary supervirus from bats and mice only for study reasons, but there are many questionable aspects to this. Is it worth the risk? It's an experiment, of course, but it is worrisome. It worries many scientists. It is a group of Chinese researchers attaching a protein taken from bats to the SARS virus, acute pneumonia derived from mice. The output is a super coronavirus that could affect man. It remains closed in laboratories, and it is only for study purposes, but it is worth the risk. Creating such a great threat only for examination purposes? The debate about the risks of research is as old as science itself, like the myth of Icarus, who plunged from the sky and perished in the sea, having gone too close to the sun with the wings of wax designed by his father. Here is an experiment in China in which a group of scientists have managed to develop a chimera, an organism modified by attaching the surface protein of a coronavirus found in bats of the common species called the great horseshoe bat to a virus that causes SARS in mice, although in non-fatal form. It was suspected that the protein could make the chimeric hybrid organism suitable for affecting humans, and the experiment confirmed it. Just 1 year ago, this broadcast is of 2015, the US government suspended research funding which aimed to make viruses more contagious. The moratorium did not stop the work of the Chinese on SARS, which was already in advanced stages and looked relatively harmless. According to a section of the scientific community, it is in fact not dangerous. The probability that the virus may pass to our species was insignificant compared to the benefits of the virus, an argument that many other experts rejected. First, because the relationship between risk and benefit is difficult to evaluate, and second, because especially in these times, it is more prudent to not put into circulation an organism that can escape or be removed from the control of laboratories, a 28 days later scenario, if you will. Science is our God now. We worship God. We don't worship God anymore. We worship science and its acolytes, the priests of science called experts, I cannot see any reason why experimentation of this kind should be permitted. I think it should all be closed down, and scientists who continue in it should be imprisoned and or perhaps even executed. Because if you look at the possible benefit versus the possible risk, and the possible risk is the death of millions, hundreds of millions, perhaps the whole planet, it seems obvious that this kind of research cannot be justified. A couple of stories from the Washington Times. Chinese researchers isolated deadly bat coronaviruses near Wuhan animal market. Now, this is from yesterday, Bill Gertz. Chinese government researchers isolated more than 2,000 new viruses, including deadly bat coronaviruses, and carried out scientific work on them just 3 miles from a wild animal market, or wet market, identified as the epicenter of the COVID-19 pandemic. Several Chinese state media outlets in recent months touted the virus research and lionized, in particular, a key researcher in Wuhan, Tian Zhenhua, as a leader in bat virus work. The coronavirus strain, now infecting hundreds of thousands of people globally, mutated from bats believed to have infected animals and people at a wild animal market in Wuhan. The exact origin of the virus, however, remains a mystery. This is one of the worst cover-ups in human history, and now the world is facing a global pandemic. Representative Michael McCall, Republican of Texas and ranking member of the House Foreign Affairs Committee, said last week. McCall said that China should be held accountable for the pandemic. A video posted online in December and funded by the Chinese government shows a Tian inside caves in Hubei province taking samples from captured bats and storing them in vials. I am not a doctor, but I work to cure and save people, Tian says in the video. I am not a soldier, but I work to safeguard an invisible national defense line. Yes, it's a very nationalistic sentiment, isn't it? Chinese officials have said the virus likely spread from wild animals to people at Wuhan's Huanan seafood wholesale market, not far from the Wuhan Centers for Disease Control and Prevention, the National Center for China's Bat Virus Research. Here's a story from the Washington Times yesterday. Incredible. China is permitting wild animal markets to resume selling bats, believed to be the source for the deadly coronavirus now killing people across the globe, including over 2,500 Americans to date, British reporters say. Chinese authorities in January closed down the Wuhan city wet market after 5 of its workers were among the first diagnosed with what would become COVID-19. A number of scientists say it is likely that bats either infected other market animals or humans directly. Bats carry a variety of coronaviruses and are blamed for the 2002 SARS coronavirus epidemic that also originated in a Chinese market. The Chinese People's Congress voted February 24th to close all the country's wild animal markets. The Daily Mail reported on Saturday, will they ever learn? Chinese markets are still selling bats and slaughtering rabbits on blood-soaked floors as Beijing celebrates victory over coronavirus. The Mail said, one source says that the markets have gone back to operating in exactly the same way as they did before coronavirus, despite the outbreaks linked to bats. Terrified dogs and cats crammed into rusty cages, bats and scorpions offered for sale as traditional medicine, rabbits and ducks slaughtered and skinned side by side on a stone floor covered with blood, filth, and animal remains. We need a cordon sanitaire separating us from this country. I'm just going to throw out a hypothesis here that the coronavirus panic, which is again wholly unjustified, could have been created by a rogue nation in order to shut down the economies of the West, and that agents or fellow travelers of this rogue country could have drummed up the panic. They could be among the experts telling us that we're all going to die unless we institute totalitarianism and crush the economy, perhaps forever. Who else benefits from this? Well, the media. has benefited. There may be a backlash. I certainly hope there will be a backlash. But the media is telling us that they are the real heroes of the COVID-19 story. They're out there on the front lines. I don't really know what that means. Calling people from your office or from your home doesn't strike me as being on the front lines. But nobody or few people buy physical news media any longer. The magazines that still exist, they exist because of the art in them. Vanity Fair, Architectural Digest, Vogue, etc. Not for the news, but for the pictures. The New York Times, of course, was bailed out by a Mexican billionaire. The Washington Post was bailed out by Jeff Bezos. The opinion magazines that still exist in physical form, they're all 501c operations. That is to say, they are not for profit, so they depend on clicks. And we all know the expression clickbait, which is the more outrageous or disgusting or shocking a story is, or the more asinine, the more likely it is to be clicked on. Now, the coronavirus is a boon to people, to misanthropes, to people who hate humanity, who hate their fellow people, because it has given us an excuse to treat every other person on earth as potentially a deadly threat to each and every one of us, which means social isolation, which means the death of society. Again, from VDAIR, our own John Derbyshire says, all is forgiven, Ramesh. And he writes, during my 15 years hanging out at National Review, there were inevitably some staffers I liked a lot, some I had no feelings about, some I didn't much care for. And then there was Ramesh Ponnuru. From a 2015 post of mine, one of the first to unleash his stiletto in the April 2012 business, for example, was senior editor Ramesh Ponnuru, in whom high intelligence, ready wit, and a wonkish mastery of political detail are combined with a feline talent for intrigue and a patience in revenge that would have elevated him to the highest levels in the court of an Oriental despot. I must say, though, that this tweet from yesterday has redeemed Ramesh completely in my eyes. And Ramesh tweeted, "It's so hard not seeing other people. I can only imagine how hard it is for people who actually like other people." Lou Dobbs reports, CBS News admits mistake after airing footage of overcrowded Italian hospital in report about New York City. Yes, the news media seems to make an awful lot of this kind of mistake. Yes, is it a mistake when they publish things which are going to incite panic and lead to more clicks, especially since with people largely banished to their homes, they have even more time to stare at a screen than they did previously? Or how about mistakes that tend to impugn the administration of President Donald Trump? Now, if you're looking at people who are responsible for this panic in terms of malice, yes, again, the news media has weaponized COVID-19 or the Wu flu against President Trump. Now, you might recall that at the very beginning, we heard from Vox and everyone else, they were parroting what the World Health Organization was saying, which was, and perhaps this line came from China, nothing to see here. In fact, the WHO took the Chinese line that it's not even proved that this was a transmissible disease from person to person. Then they realized that, yes, this could definitely hurt Donald Trump. So after, 3 years of complaining that Donald Trump was a fascist dictator, or certainly aspired to be one, they started taking the line that Trump was a failure because he was not a fascist dictator. And again, the cognitive dissonance of the left, that Trump is simultaneously a buffoon, and also a sinister mastermind. Let's see. Oh, yes. This fellow, Mike Lindell, I used to see him when I had cable TV. He has a pillow company, My Pillow, in Minnesota, I believe. And he hawks it as the best pillow in the world, one which will give you the best sleep of your life. I don't know. It could be true. He seems like a good man. And he decided that he was going to convert his factory over to making masks for his fellow citizens, 50,000 per day by the end of the week. And the reaction on Twitter was, how dare he, what a terrible man he is. And why is he a terrible man? Well, because he is known to be an ally of Donald Trump. And he is taking an action which perhaps could vitiate the pandemic and the panic that follows. So that makes him, double plus ungood. I mentioned this story when it was in the British media a couple of days ago, but it appears in the New York Post today. And if you have any doubt that the media is attempting to instill, foment, broadcast, amplify panic, social distancing guidelines to stay 6 feet from others may be woefully inadequate, one scientist warned, saying the coronavirus can travel 27 feet and linger for hours. As Alan Partridge would say, liquid AIDS. MIT Associate Professor Lydia Boriba, and of course it's a woman, who has researched the dynamics of coughs and sneezes for years, warns in newly published research that the current guidelines are based on outdated models from the 1930s. Rather than the assumed safety of 6 feet, Boriba warns that pathogen-bearing droplets of all sizes can travel 23 to 27 feet. Her research, published in the Journal of the American Medical Association, also warns that droplets that settle along the trajectory can contaminate surfaces, and residues or droplet nuclei may stay suspended in the air for hours. Okay, so 23 to 27 feet, we have to keep that distance at all times. Also, COVID-19 virus can remain alive on metal surfaces for up to 9 days. We're all doomed. That is the message. If what this woman is saying is true, it seems to be fairly obvious to me that everyone in the world must be infected by COVID-19. And if everyone in the world is infected by it, but then the numbers of so-called confirmed cases, whatever that might be, and deaths, they're small. They're pitifully small. Let's go to the chat here. Hello, friends. It's KMG returning tomorrow. Yes, I addressed that at the beginning of the show. I will have my broadband until the 6th. So I'm good to at least the end of the week. Kevin, you should ask for payment assistance. Trudeau promised to cover that. The problem is that I do not have a job. And I haven't been working actually for quite a number of years. I'm essentially retired. Chogan King 666 says post office looked like a secure biohazard facility, had plastic sheeting up between you and the desks. Brandon Smith, American admiral, sounding the alarm that his crew is so sick they're going to lose the boat. I'm going to get to that. It's a captain, actually. Let's see, Brandon Smith, Fort Detrick in the U.S. got shut down over this sort of thing, safety protocol breaches. All right. Okay, let's see. Yeah, it's best that I go, best that I go. But just how deadly is the coronavirus? It is not at all proved that it is, in fact, all that deadly. I'm depending here, for the next few stories I'm going to cite, on the valuable work of a fellow YouTuber, and his name is James Corbett. And his channel is called The Seventh Day Truth Seeker, or the Corbett Report. And he cites mainstream sources, not wacky, wild, tinfoil hat sources. Here's the Telegraph, which is, after the Times, the most respected newspaper in Britain, and it was dubbed by Private Eye decades ago as the Tory Graph because of its very close connections to the British Conservative Party. A story as far back as March the 23rd by Sarah Newey. Why have so many coronavirus patients died in Italy? The country's high death toll is due to an aging population, overstretched health system, and the way fatalities are reported. As of March 23rd, of the 63,927 people confirmed coronavirus patients in Italy, 6,077 so far have died. By contrast, China has many more cases, 81,496, but 3,274 fatalities. In very crude terms, this means that around 9% of confirmed coronavirus patients have died in Italy, compared to 4% in China and 0.4% in Germany. Why the disparity? According to Professor Walter Riccardi, a scientific advisor to Italy's Minister of Health, the country's mortality rate is far higher due to demographics. The nation has the second oldest population in the world, and the manner in which hospitals record deaths. The age of our patients in hospital is substantially older. The median is 67, while in China it was 47, Riccardi says. So essentially, the age distribution of our patients is squeezed to an older age, and this is substantial in increasing the lethality. A study in JMA this week found that almost 40% of the infections and 87% of deaths in the country had been in patients over 70 years old. Riccardi added that Italy's death rate may also appear high because of how doctors record fatalities. The way in which we code deaths in our country is very generous, in the sense that all of the people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. Now, here is the money graph. On reevaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity. Many had 2 or 3. So what this means is that people are dying of cancer, they're dying of heart attacks, etc., and these deaths are being ascribed to coronavirus because people have the coronavirus. As Corbett points out, if you take the 88% figure, this means that the real death toll in Italy could be as low as 700. There are other factors that may have contributed to Italy's fatality rates, experts say. This includes a high rate of smoking and pollution. The majority of deaths have been in the northern region of Lombardy, which is notorious for poor air quality. So what else? Yes, the Off Guardian, it highlights only 12% of COVID-19 deaths list COVID-19 as a cause. Now, this is really shocking. This is not secret. This is not occult information. Again, I'll use my example from last week, that 90% of Americans have Epstein-Barr virus present in their bodies. Up to 50% of children at the age of 5 in the United States. Epstein-Barr causes mononucleosis. It has other health consequences. Some years ago, it was blamed for an imaginary condition called chronic fatigue syndrome. But let's suppose that we postulate that Epstein-Barr is a deadly virus. Well, if that was the case, then 90% of all deaths in the United States, which were not from causes such as suicide, murder, accidents, etc., could then be ascribed to Epstein-Barr virus, which would obviously be absurd. Off Guardian repeated some of what Riccardi had said and noted this has been widely reported even in the Telegraph, and yet no one seems to be engaging with it. The president of the Italian Civil Protection Service actually went out of his way to remind people of the nature of Italy's fatality figures in a morning briefing on March the 20th. I want you to remember these people died with the coronavirus and not from the coronavirus. What does this actually mean? It means the Italian death toll figures could have been artificially inflated by up to 88%. If true, this would mean the total number of Italians who have actually died of COVID-19 could be as low as 700, which would bring Italy, currently a statistical outlier in terms of COVID-19 fatalities, well in line with the rest of the world. This statistic is not a secret or in any way controversial. It was in the Telegraph after all, but people seem to be ignoring it or reading around it or perhaps simply not understanding. Now, when you have a situation of suppressio veri, to use the Latin tag, or of people ignoring a fact, which tends to place a narrative in danger, you have to ask the question again, qui bono? Who benefits? And I've suggested two groups that benefit from this. And this is from the Italian government. Mean age of patients dying of COVID-19 infection was 78. Median 79. Now, the life expectancy in Italy is 82. And it goes into the comorbidities that over 50%, let's see, zero comorbidities, that is to say other serious conditions, medical conditions, zero in Italy, 2.1%. One comorbidity, 21.3%. Two comorbidities, 25.9%. Three comorbidities are over 50.7%. What these figures demonstrate is that COVID-19 is not dangerous, or particularly dangerous, unless you are very old indeed, and you already suffer from a number of other conditions. Such as heart disease, obesity, diabetes, etc., etc. Now, Corbett pointed out, he talked specifically about the problem of air pollution in northern Italy, which is a heavily industrialized area. This is a story from an Italian paper, The Local, in 2017. Italian cities need to breathe again, the country's environmental organization, Legambiente, warned Monday as it reported the first month of 2017 has seen 9 Italian towns pass safe limits for air pollution on at least half the days. The news came as several northern cities imposed traffic blocks in an effort to combat air pollution. The environmental counselor in Pavia, a university town in Lombardy, advised residents to stay indoors as much as possible. In Rome, cars account for 70% of the smog, with only 30% of the problem is down to heating or heavy industry. On a national level, the most polluted town of 2017 so far is Cremona in, again, Lombardy, where safe limits for fine particles have been surpassed for 20 days already this year. Turin follows with 19 days over the pollution limit, then Frosinone, Oni in Lazio at 18, and Padua, Vicenza, and Reggio Emilia had all passed 15 days. Some other news from Italy that Corbett had ferried out. A water supply alert after 150 pneumonia cases in Brescia, Italy. Authorities suspect the presence of a pneumonia-causing virus is lurking in the water supply in that city. This is from September 2018, and it is from Sky News, which is hardly an alternative publication. A Swiss doctor on COVID-19 from March the 14th. According to the latest data of the Italian National Health Institute, the average age of the positively tested deceased in Italy is currently around 81. 10% of the deceased are over 90 years old. 90% of the deceased are over 70 years old. 80% of the deceased has suffered from 2 or more chronic diseases. 50% of the deceased had suffered from 3 or more chronic diseases, and these diseases include, in particular, cardiovascular problems, diabetes, respiratory problems, and cancer. Less than 1% of the deceased were healthy persons, i.e. persons without pre-existing chronic diseases. Only about 30% of the deceased are women. The Italian Institute of Health, moreover, distinguishes between those who died from the coronavirus and those who died with the coronavirus. In many cases, it is not yet clear whether the persons died from the virus or from their pre-existing chronic diseases or from a combination of both. This is rather akin to a car going against a red light, running through an intersection, running a man down and killing him, and because he was a smoker, his death being attributed to tobacco. To wrap up with Corbett, he talks about the things you cannot say about coronavirus. Are you interested in talking about things, the kind of things that we're not allowed to talk about anymore, since the event? You are great. I mean, you might have noticed things are getting a bit hairy out there, as in you're likely to get your head bitten off for daring to suggest that things may not be totally okay with the new normal. It seems all these new social norms and cultural taboos that have arisen in the past few weeks have also created a raft of new thought crimes. Things that must not be spoken for fear of being expelled from polite society, or worse. That's why it's so vitally important for us to speak about our concerns before these socially policed thought crimes become literal crimes. As I'm sure you'll know, if these new social norms are not confronted, voicing dissent will soon become impossible. And I will note that in at least one country, Hungary, it is now a crime to spread misinformation. We have met the enemy, and it is our neighbors. People imagine that when boots on the ground tyranny arrives, it will be enforced by the police or the military. Newsflash, the boots on the ground tyranny is here and is being enforced by your neighbors, Joe Sixpack and Jane Soccer Mom. As I said on Twitter a few days ago, that the coronavirus panic, the sanitary dictatorship, as Bishop Schneider calls it, is the result of a fatal conjunction between boomer millennialism and matriarchal consensus. Need proof? How about all the new snitch lines that are opening up in city after city and state all around the globe to help good citizens tattle on neighbors who aren't practicing proper social distancing? That's right, it's not just guys yelling out their windows in Brooklyn anymore. Now, whenever you see someone within 2 meters of someone else, it is your duty as a loyal citizen of the brave new world order to actively report them to the authorities so that they can be dealt with by Big Brother. Rest assured, a scorecard is being compiled for each jurisdiction. Number 2, doctors are the new soldiers. When 9/11 happened, there was a marked and notable intensification in the propaganda glorying the American military. Not that such propaganda didn't exist before, but it was nothing like we've seen since the day that changed everything. Yes, the hero worship of veterans is one of the hallmarks of the age of terror that 9/11 ushered in. So if this pandemic is the new 9/11, what's the new hero worship? Well, it should be obvious by now. Doctors are the new soldiers. You may have noticed the interesting phenomenon making its way around the world. I call it the totally spontaneous baloney applause phenomenon. Yes, completely out of the blue, all the people under lockdown have decided to show their appreciation for the valiant doctors and nurses in this heroic struggle by going to their balcony at a pre-appointed time and applauding. And I saw the gay leprechaun, who's a Newfoundland MP, Seamus O'Regan. He was touting such a thing in Newfoundland, which has one death ascribed to coronavirus. And no, this totally spontaneous phenomenon is not just occurring in 1 or 2 countries, or 3 or 4, but in seemingly every country around the globe, just like that, just out of the blue. I find these displays creepy and off-putting. I find the glorification of doctors and nurses unsettling, not because I think they are all quacks, not because I think that they are all evil, not because I'm not grateful for the work that some doctors do some of the time, not because I don't recognize the enormous stress that these doctors and nurses are under right now, but because this socially engineered adoration is going to be used to push an agenda exactly like the glorification of veterans was used to push the militarism agenda of the post 9/11 years. Number 3, I do not trust a single one of the numbers being reported at this outbreak. What do we make of the baffling discrepancy in death rates from COVID-19 between different countries? People are throwing around CFRs and R0s like they've been studying epidemiology their whole lives. In truth, they're just regurgitating whatever they saw on CNN or were told in the latest Governor Cuomo press conference. Number 4, the death of a 91-year-old is a family tragedy, not an event of international concern. Okay, so you still insist on taking these phony baloney numbers seriously? Yes, the report, the official Italian report, puts the median age at 78 in Italy. That means those who are dying with, not of the disease, are within years, 4 to 5 years specifically, of reaching the average life expectancy. And let's not forget, they are also suffering in the vast majority of cases from at least 2 other diseases. Since we're committing thought crimes here, let's be blunt. Elderly patient with multiple complications dies after contracting respiratory illness is not a news story. It is a daily fact of life. But in fact, it is a news story. I've been keeping tabs on how the Canadian mainstream media have been covering the pandemic panic, and saw a segment on one of those national news broadcasts about a woman whose 91-year-old mother died in a nursing home. It was implied that this 91-year-old woman's life was tragically cut short by the coronavirus, and to make matters worse, her daughter was unable to hold a funeral or service for her mother because Canada is currently under lockdown. I don't know if I have lost touch with reality or everyone else has, but let me reiterate, this is not a news story. Now, I've mentioned before, and I say this because I think that it's relevant, not that I'm special pleading or looking for sympathy, but my father, Michael Grace, if he lives that long, will be 89 years old on April the 10th. He is currently in a long-term facility suffering from dementia. And it will be sad when my father dies, but why would anyone believe that there was something shocking about this? People don't live forever, and I'm getting the impression that what the COVID-19 has brought home to people is something that they should have considered every single day of their adult lives, that one day they are going to die, and to plan accordingly. Number 5, the idea that disease and death are unnatural or avoidable is anti-human. People die. Sometimes they die of car accidents. Sometimes they die of work-related mishaps. Sometimes they die of old age. Sometimes they die under extremely questionable circumstances while trying to shed light on information that is uncomfortable for the deep state. And yes, sometimes they die of respiratory illnesses during viral pandemics. I'll go one step further. Our mortality makes us who we are. Humans are blessed and cursed with the knowledge of our own fate. No one makes it out of this life alive. And so the question of what we do with our lives becomes paramount, as this isn't in the article. But I'm reminded that a great author once said, life is not a problem to be solved. It is a purpose to be fulfilled. That was Joseph Conrad. More and more death is being removed from life. Our elderly are shipped off to nursing homes to wither away so that we don't have to face aging. The funerary industry is neat and antiseptic. Death has become an abstraction, something that happens somewhere out there to other people, not to us, though, surely. Yes, and it would appear, I've seen studies indicating that it would seem that a majority of people, say, with cancer now or other exceedingly painful diseases are not dying of the disease. They are dying of morphine overdoses, because we don't want old people to be embarrassing in their death throes. So let's see, COVID-19 updated data implies that UK modeling hugely overestimates the expected death rates from infection. And I had mentioned or quoted at great length last week a story from Off Guardian of 12 experts that were criticizing the coronavirus panic. Well, they have come up with 10 more. Dr. Sunitra Gupta and his Oxford-based research team constructed an epidemiological model for the coronavirus outbreak. He says, or the team says, importantly, the results we present here suggest the ongoing epidemics in the UK and Italy started at least a month before the first reported death and have already led to the accumulation of significant levels of herd immunity in both countries. Yes, again, if people are not safe until you get 24 to 27 feet away, and this virus can live on metal surfaces, and we all touch metal surfaces every day of our lives, doorknobs, faucets, etc. This would suggest that the entire population of the world has it. The Oxford results would mean the country had already acquired substantial immunity through the unrecognized spread of COVID-19 over more than 2 months. Dr. Karen Möhling, a German virologist whose research is focused on retroviruses, said, "You are now told every morning how many SARS corona-2 deaths there are, but they don't tell you how many people already are infected with influenza this winter and how many deaths it has caused. This winter, the flu is not severe, but around 80,000 are infected. You don't get these numbers at all. Something similar occurred 2 years ago. This is not put into the right context. Every week, a person dies in Berlin from multi-resistant germs. That adds up to 35,000 a year in Germany. This is not mentioned at all. I believe that we have had situations like this several times and that the measures are now being taken too far. I'm of the opinion that maybe one should not do so much against young people having parties together and infecting each other. We have to build immunity somehow. How can that be possible without contacts? The younger ones handle the infection much better, but we have to protect the elderly and protect them in a way that can be scrutinized. The Robert Koch Institute, or Koch, I don't know how that's pronounced, provides the figures. Then you sit there as a listener or spectator, 20 dead again, how terrible. Do you know when I would start to panic? If there are 20,000. Then we can get close to went on completely quietly 2 years ago. The 2018 influenza epidemic with 25,000 deaths never disconcerted the press. The clinics had to deal with an additional 60,000 patients, which was no problem in the clinics either. And of course, I'll just mention that I was talking to a relative of mine today. He had a very serious operation in December. He was in hospital for 13 days. There are a number of follow-ups that he needs after this operation. And there are related conditions which have come up because of his surgery and the medical problem that he suffered. But these things have been canceled because we need every bed for people with coronavirus. And in any event, he told me that he has no interest in going to a hospital during this panic because hospitals are the most dangerous, well, and old age homes are the most dangerous places on earth now. Dr. Anders Tegnell, a Swedish physician and civil servant who has been state epidemiologist of the Public Health Agency of Sweden since 2013, says, all measures that we take must be feasible over a longer period of time. Otherwise, the population will lose acceptance of the entire corona strategy. Older people or people with previous health problems should be isolated as much as possible. So no visits to children or grandchildren, no journeys by public transport, if possible, no shopping. That is the one rule. The other is anyone with symptoms should stay at home immediately, even with the slightest cough. If you follow these two rules, you don't need any further measures, the effect of which is only very marginal. Anyway, Dr. Pablo Goldschmidt, an Argentine-French virologist specializing in tropical diseases and professor of molecular pharmacology at the Université Pierre et Marie Curie in Paris, says, the ill-founded opinions expressed by international experts, replicated by the media and social networks, repeat the unnecessary panic that we have previously experienced. The coronavirus identified in China in 2019 caused nothing less than a strong cold or flu, with no difference so far with the cold or flu that we know. Respiratory viral conditions are numerous and are caused by several viral families and species. Our planet is the victim of a new sociological phenomenon, scientific media harassment, triggered by experts, only on the basis of laboratory molecular diagnostic analysis results. Communiques issued from China and Geneva, that'd be the WHO, were replicated without being confronted from a critical point of view, and above all, without stressing that coronaviruses have always infected humans and always caused diarrhea and what people call a banal cold or common cold. Absurd forecasts were extrapolated, as in 2009 with the H1N1 influenza virus. The WHO is a useless organization. It's obviously been suborned by China. What did we hear first from the WHO? Oh, it's all, everything's under control in China. There's no evidence that it's transmissible from person to person. And the biggest problem is stigmatization, xenophobia, and racism. Why are we listening to this useless, suborned institution? Doctors Aaron Ben-David and Jay Bhattacharya, professors of medicine and public health at Stanford University. Projections of the death toll, they say, could possibly be orders of magnitude too high. The true fatality rate is the portion of those infected who die, not the deaths from identified positive cases. A universal quarantine may not be worth the costs it imposes on the economy, community, and individual mental and physical health. We should undertake immediate steps to evaluate the empirical basis of the current lockdowns. And this was published in the Wall Street Journal, which again is not what you would call a tinfoil hat publication. Dr. Tom Jefferson is a British epidemiologist based in Rome, works for the Cochrane Collaboration, also an advisor to the Italian National Agency for Regional Health Services. He says, "So I cannot answer my nagging doubts. There does not seem to be anything special about this particular epidemic of influenza-like illness. There are, however, two consequences of this situation that bother me. The first is the lack of institutional credibility as perceived by my friends. They range from firefighters, policemen, and even a GP, not the kind of people you would want to alienate in emergency. A restaurant owner told me he would never report himself to the health authority, as that would mean at least 2 weeks of closure and his business would go to the wall. The second is that once the limelight has moved on, will there be a serious and concentrated international effort to understand the causes and origins of influenza-like illnesses and the life cycle of its agents? Past form tells me not, and we will go back to pushing influenza as a universal plague under the roof of the hothouse of commercial difference." Dr. Michael Levitt, professor of biochemistry at Stanford and a fellow of the Royal Society, a member of the National Academy of Sciences, he received the 2013 Nobel Prize in Chemistry. He says, "I don't believe the numbers in Israel, not because they're made up, but because the definition of a case in Israel keeps changing, and it's hard to evaluate the numbers that way. There is a lot of unjustified panic in Israel. I don't believe the numbers here. Everything is politics, not math. I will be surprised if the number of deaths in Israel surpasses 10 or even 5 now with the restrictions." The German Network for Evidence-Based Medicine says, "In the majority of cases, COVID-19 takes the form of a mild cold or is even symptom-free. Therefore, it is highly unlikely that all cases of infection are recorded, in contrast with deaths which are almost completely recorded. This leads to an overestimation of the CFR. The widespread availability of SARS-CoV-2 tests is limited. As the disease spreads, it becomes increasingly difficult to identify a suspected source of infection. As a result, common colds in people who unknowingly had contact with a COVID-19 patient are not necessarily associated with COVID-19, and those affected do not go to the doctor at all. A systematic review from 2015 found moderate evidence that school closures delay the spread of an influenza epidemic, but at high cost. Isolation at home slows down the spread of influenza, but leads to increased infection of family members. It is questionable whether these findings can be transferred from influenza to COVID-19. Many questions remain unanswered. On the one hand, the media confronts us daily with alarming reports of an exponentially increasing number of ill and dead people worldwide. On the other hand, the media coverage in no way considers our required criteria for evidence-based risk communications. Dr. Richard Shabbos, a former chief medical officer of Ontario, says far more cases are out there than are being reported. This is because many cases have no symptoms and testing capacity has been limited. There have been about 100,000 cases reported to date, but if we extrapolate from the number of reported deaths and presumed case fatality rate of 0.5%, the real number is probably closer to 2 million, the vast majority mild or asymptomatic. We need to be sensible. Quarantine belongs back in the Middle Ages. Save your masks for robbing banks. Stay calm and carry on. Let's not make our attempted cures worse than the disease. I'll go back to the chat here. Okay, so there's a shortage of masks. China's got them all. China is sending masks to the West, and at least half of them are defective. I keep seeing arguments, repeated arguments, people saying, no, you have to be very careful in how you use masks, and if you use masks incorrectly, it's worse than not wearing a mask, with others claiming that there is no reason for people to wear masks, that it is useless. I don't know anything about that, but the fact that we are having this discussion, indicates how panic-stricken everyone has become. Ricky Bullock says Kevin is right about the conspiracy against secondhand smoke, but yeah, I think tobacco is unhealthy. I don't think inhaling smoke is generally good for your lungs. Yeah, I broadly would agree with that, but I would point out that Hans Eysenck, the famous psychologist, argued that he didn't think that lung cancer had anything to do with tobacco. If you see the kind of people who are affected by this, typically they are people who make bad decisions in life, overall bad health decisions. Let's see. Tobacco is bad for you. Well, I don't know. I mean, it's typical for people to smoke 40, 50, 60 years before they begin to suffer severely from it. That's an awfully long period of time. Menthol cigarettes are the most damaging, says Dawn from Beyond. Years ago, when I was quite poor and working in telemarketing, that gives you an idea of how desperate I was. I couldn't afford cigarettes, and it was mostly women who worked in this place. And there was this nice woman, and I saw her smoking, and I said, "Do you mind if I bum a cigarette off you?" And she said, "Sure." And she gave me this cigarette, and I thought, finally. And I lit it up, and I thought, what is this poison? This is disgusting. How could anyone smoke this? And then I saw that it was a menthol cigarette. There was a vogue a few decades ago for clove cigarettes. Now, I guess, I must be a stupid person because I thought, ooh, everyone's talking about clove cigarettes. So let's buy a pack of these clove cigarettes and see how that works out. Well, I was going downtown to a pub, and I had smoked one on the way. And I was in the pub for about 5 minutes, and I began to feel that I was at the bottom of a well. And I had to go home and pretty much, go to sleep. I think I slept something like 16 out of the next 24 hours. So I threw that away. Never again. Okay, what else do we got here? Jules Roy, alas, a lot of conservatives believe there was an anti-tobacco conspiracy. It was quite a common take in the 90s. I believe that there is an anti-tobacco conspiracy. Look, we were told lies about tobacco, of the tremendous costs associated with it. Well, first of all, especially after Bill Clinton put his oar in, when I was living in San Diego in the mid-90s, I was paying $14, $15 a carton for cigarettes. What is it now in the United States? $50, $60, $70 a carton. In Canada, it's something like about, what, $125 a carton? Okay, so smokers pay an enormous amount of taxes to the government. Secondly, if one believes Dr. Richard Dahl and such like, they die 5 years earlier on average than non-smokers. What this means is that they save governments in healthcare costs and in pension costs an enormous amount of money. As I pointed out on the show previously, Even before COVID-19, there was a healthcare policy disaster, which is well known to people within government, but they don't want to talk about it because of the implications, which is that it won't be very long before the state can no longer afford to pay for people in long-term health facilities. I mean, if people have the money, then that money gets drained from them, and then they don't have any money to leave to their descendants. But if they don't have any money, then it comes from the state. And I mentioned the case, which became a foolish scandal in my province of British Columbia, where a husband and wife were separated. And it turns out, and this was, I think, over 10 years ago, that the annual cost of keeping a person in a long-term health facility, ones that requires constant monitoring and the like, was at that time, it was $255,000 a year per person. Now we pay, the Canadian government pays something like about $100,000 a year to keep men in prison. So okay, what else we got? Eternal Fisherman says, I feel like that guy who came up with something in school and his neighbor took it and acts as if it's his, LOL. And well, people with higher income equals higher IQ equals healthier. Well, that is absolutely true. I'll give you one example. The more money you have, the bigger your car is likely to be. You see these AWFLs, and they're all in their 4x4s. They're all looming over everyone. Well, the bigger the car you have, the less likely you are to be killed in a car accident. It is rare for wealthy people to die in car accidents, and it is not all that rare for poor people to die in car accidents because they are driving smaller, crummier cars. Alex Delarge says there's a point at which skepticism falls into crank kook territory. Well, I don't think that is kooky to point out that it turns out that 88% of deaths in Italy ascribed to coronavirus are not, in fact, from coronavirus. I don't think that is kooky at all. Do it, KMG, mod Ricardo. Okay. Yeah, okay. I thought we had a moderator. I suppose we need more than one. I'm writing this down here. So I was thinking the subject of death. No one here gets out alive. I don't think people really understand how many people die every year in the United States. So I have some figures for you. In 2017, this is the latest figures from the CDC, 2,813,503 people died in the United States. That works out to, on a weekly basis, 54,106, on a monthly basis, 234,459, and on a daily basis, 7,708. So, and people die from all sorts of causes. Influenza deaths in the United States in 2017 were 55,672, which works out, and that was a mild year for influenza, that worked out to 4,639 Americans per month dying of influenza. Over 47,000 people die of suicide every year in the United States. 170,000 Americans die every year from accidents. Death is truly all around us, but we have decided that we can banish it. And now it rears its ugly head. And I don't know, we pretend that we didn't know that it was all around us, and then it will come to us all. And of course, the older one is, the higher the likelihood that one is closer to death, much, much closer to death when you get into into people over 75, and particularly people over 80 and 90. Yeah, even if, and I'll mention this, even if smoking is dangerous, it is even the experts agree that it is far less dangerous than morbid obesity. Now, so we were talking about malice versus stupidity. There's no question, at least in my mind, that our leaders are, for the most part, callow and feckless people. One only has to look at Justin Trudeau for an example of this. Or, I don't know, Boris Johnson. Boris Johnson was railing against the critarchy of what they call the Supreme Court in Great Britain, which is a very new and callow institution. He becomes prime minister, and shortly thereafter, he pretty much declares himself to be the czar. Based on what? A model from more than 13 years ago, of thousands of lines of undocumented C code, a model that was abjured by the fellow who wrote it, Neil Ferguson. That is the basis on which people are being followed by drones, being shouted at through bullhorns to get off the grass on a sunny day or to end your ramble. Is this trip essential? It's a remarkable transformation. Our leaders are not what they were. For all this talk about World War II, I'm not a fan of Franklin Roosevelt or Winston Churchill, but they appear as giants compared to the leaders that we have now. Incompetence is all around us, and incompetence is not punished. Are the execs at Boeing, are they in sackcloth and ashes? The execs at Hewlett-Packard? A couple of women wrecked that great American company. Are they in sackcloth and ashes? No, they got golden parachutes. Once again, after 9/11, I thought there is going to be a purge. Thousands of people are going to lose their jobs. How could this have happened, been allowed to have happened, when it had been known for some time of the possibility, there was much talk of the possibility of planes being used as weapons, and the screening system in the airports not fit for purpose. So all these people were going to get canned. Nobody got canned. All of the experts in government, in the media, in the elite, who claimed that the invasion of Iraq in 2003 and the subsequent occupation would be a cakewalk. Well, they couldn't have been more wrong. And how many people got fired there? How many people were disgraced? How many people wore sackcloth and ashes? Well, none, as far as I can see. And I was alerted to something that's going on in the US military that was mentioned in the chat earlier today. And it's from an article in the San Francisco Chronicle. The captain of a nuclear aircraft carrier with more than 100 sailors infected with the coronavirus pleaded Monday with US Navy officials for resources to allow isolation of his entire crew and avoid possible deaths in a situation he described as quickly deteriorating. The unusual plea from Captain Brett Crozier, a Santa Rosa native, came in a letter obtained by the Chronicle and confirmed by a senior officer on board the aircraft carrier Theodore Roosevelt, which has been docked in Guam following a COVID-19 outbreak among the crew of more than 4,000 less than a week ago. This will require a political solution, but is the right thing to do, Crozier wrote. We are not at war. Sailors do not need to die. If we do not act now, we are failing to properly take care of our most trusted asset, our sailors. In a 4-page letter to senior military officials, Crozier said only a small contingent of infected sailors have been offboarded. Most of the crew remain aboard the ship, where following official guidelines for 14-day quarantines and social distancing is impossible. Now, this is the acme of incompetence when formal orders are given, which are literally impossible. The Navy did not respond to the Chronicle's request for comments, but on Tuesday, the acting Navy Secretary, Thomas Maudley, told CNN, "I heard about the letter from Captain Crozier. I know that our command organization has been aware of this for about 24 hours, and we have been working actually the last 7 days to move those sailors off the ship and get them into accommodations in Guam. The problem is that Guam doesn't have enough beds right now, and we're having to talk to the government there to see if we can get some hotel space, create tent-type facilities." Well, given that the pull that the U.S. Navy has in Guam, I should have thought that that would have been easy enough for them to do if they were really serious about it. But, increasingly, we are led by people who are not serious. Our prime minister, what's he famous for? He's famous for his socks. Yes, indeed. Endless news stories about socks. Also about how hunky he is. Ooh, just so dreamy. As I wrote in VDare last year, Trudeau, became prime minister amidst an atmosphere of psychosexual hysteria among men as well as women. This is a fellow with absolutely no accomplishments in his life. He dropped out of 2 postgraduate programs. He has an education degree. He bounced about doing various things, but he has a famous father. And he spoke at his father's funeral, Pierre Trudeau's funeral, and apparently he indicated his sadness at his father's death. And the media decided that this man must become prime minister, and sooner rather than later. Someone like Angela Merkel in Germany. How is it possible for a political leader to live through the migrant fiasco? That we have the Chancellor of Germany effectively declaring war on her own people. Well, this is a war that the media supports and the elite supports. The German people certainly do not support it, even if they are too terrified to indicate their lack of support. It's a phrase ascribed to Tony Blair, never let a crisis go to waste. Well, you see, it turns out it's not necessary to have an actual crisis. You can simply invent one. Mayor Muriel Bowser of Washington, D.C. is threatening residents with 90 days in jail and a $5,000 fine if they leave their homes during the coronavirus outbreak. How is this possible when the police have stopped arresting people and are letting everyone out of prison? You see this cognitive dissonance of the left again? The threat of jail is alarming residents and civil libertarians who point out that at least 5 inmates tested positive for COVID-19 in the city's 1,700 inmate jail near Capitol Hill. This order is similar to dictates in neighboring Maryland and Virginia, but shocked residents of Washington, where there are just 401 of the nation's 160,000 confirmed cases. This is insane. Criminal penalties, tweeted Mercedes Schlapp, President Trump's former White House Director of Strategic Communications and an advisor to his re-election campaign. The ACLU of DC filed a lawsuit Monday seeking the appointment of an expert to help depopulate the city's only jail of elderly, health-compromised, and non-violent inmates. Many inmates are awaiting trial. The labor union representing DC jail officers, a part of the Fraternal Order of Police, voted no confidence this month against Department of Correction leaders over safety conditions to prevent spread of the virus. Again, one would have thought that a certain level of danger would be accepted by law enforcement officers, but increasingly we are finding out that it is not. Hungary has a dictator now. Orban has the parliament has voted him in as a dictator, and misinformation is subject to being imprisoned. Similar situation in Serbia, it appears, according to the Associated Press. by Dusan Stoyanovich, dismantling democracy, virus used as excuse to quell dissent. Now, in terms of the key bono from the COVID virus, well, how long is this going to last for? Is it going to last into summer? Well, apparently decisions have been made in Canada that yes, it is going to last into summer. Longer than that, we had this Dr. Jenny Harries in Britain talking about 18 months. So, I mean, if people cannot stand close to other people, well, then you're going to have to suspend elections, aren't you? Unless you move to mail or internet balloting, which will mean there will never be another uncrooked election. Again, the leader of Serbia, President Alexander Vučić, announced an open-ended state of emergency. March 15th, Parliament has been sidelined, borders shut, a 12-hour police-enforced curfew imposed, and people over 65 banned from leaving their homes. The Serbian leader, who makes dramatic daily appearances issuing new decrees, has assumed full power, prompting an outcry from opponents who say he has seized control of the state in an unconstitutional manner. From Britain, which, well, you know, we in the Anglosphere like to talk about our Anglo-American tradition of liberty. It has been binned, as they would say in Britain. David Wild writes in Spiked, freedom is on the line in this lockdown. Our civil liberties have been suspended with barely a whimper of protest. Politicians are there to take difficult decisions by weighing up all the expert advice and choosing a policy with the least worst outcome depending on the options available. But in the current crisis over coronavirus, the damaging impact of drastic interference in our civil liberties has apparently barely been considered at all. Since the nationwide lockdown was announced, we have had no right of association, and so political parties, trade unions, businesses, and every other form of organization outside the state has been severely disrupted, if not destroyed. This has been cheered on by most of the national media with their shrill calls for lockdowns and punishments for people going about perfectly lawful activities. Thankfully, there are now some voices raised about particularly stupid examples of police harassment of dog owners and the constables ignoring actual crimes while investing in drones to harass moorland walkers. Yes, and as someone from Spiked, I think their editor, said recently, the police have been saying for years that they do not have the resources to fight, say, knife crime, but apparently they have the resources to harass people for leaving their homes. Let's step back for a moment. Most human beings and societies going back into prehistory have lived with the threat of disease as part of their everyday lives. It is only in the richest societies after the development of antibiotics that this harsh reality has been hidden from view for most people most of the time. The one good aspect of the current virus is that most humans will catch it and recover. And he goes on to argue that the restrictions are not only wrong in principle, but also by collapsing the economy will produce a much worse long-term outcome for society as a whole. It is the lives of young people that are being most ruined by the policy of lockdown. And as this begins to bite, they will start to ask whether it was reasonable that their lives were ruined en masse so that the politicians could say we were doing whatever it takes. There's a great deal of confusion and smoke and mirrors over the basis for the policy response. Plenty of people will die with the virus, but not from it. The poor souls with serious underlying conditions should be rightly isolated as much as possible, and that is where I believe the money should be spent. It would cost a fraction of the current projected cost of the current policy. Well, again, I have to say, first of all, that I'm quite pleased that my lonely voice in speaking out about this absurd, unwarranted panic has been joined by, it turns out, many other voices. But we are very much a minority, and yet we haven't been silenced, not yet, at any rate. And I'm going to predict again that when it turns out, when this is all over, that the bodies were not stacked like cordwood, our elite is going to have some very serious questions to ask. Now, they're going to bluff their way through it, just like Michael Fiumento has said, and others have said, and I have said, I predicted a couple of weeks ago, that they're going to pat themselves on the back and say it was only our measures, that is to say, making everyone on earth scared to death of every other person on earth, and collapsing the economy, collapsing society. How we get that started up again? Well, we're working on it. They are not going to admit willingly that they were wrong. And they will have to be forced. I mean, I'm hoping that one of the results of this could be to break the back of the elite, because our elite is certainly not fit for purpose. I suppose that's the least bad thing one could say about our elite. They hate our guts and want to hurt us. If you ever had any doubt about that, observe what has happened across the world in the last few weeks. It's hard to imagine, you know, Hitler or Stalin telling people they were not allowed to leave their homes, but that is the situation that we now find ourselves in. And Spiked also has a footnote to a much reported story. Chloe Middleton, the coronavirus death that wasn't. The 21-year-old's tragic death has not been recorded as due to COVID-19. This week, the news of the heartbreaking death of 21-year-old Chloe Middleton went across social media. She was reported to be Britain's youngest coronavirus victim with no pre-existing condition. And so her case was quickly held up as proof as to why young people thought to be too blasé about COVID-19 should take the outbreak more seriously. But The Guardian reports this afternoon that her death has not actually been recorded as a COVID-19 death. Middleton was taken to Wexham Park Hospital in Slough last weekend after she had a heart attack. Attempts to resuscitate her failed, and she was pronounced dead soon after arriving. A Berkshire coroner said the death was related to COVID-19 after being told Middleton had a cough, the source said, but this surprised medics at the hospital who have not recorded it as a coronavirus death. Whole Foods employees are staging a nationwide sick-out. Workers say they will strike Tuesday because the Amazon subsidiary has failed to prioritize their safety during a period of record sales. They're planning to strike to protest the lack of protections offered to workers, the first national collective action led by the workers of the company since it was founded in 1980. And Whole Foods is owned, of course, by Jeff Bezos. And Amazon. Well, grocery stores are still open, but what if they all take after Whole Foods and say they are not going to go into work? Well, then I suppose they actually would have a looting situation then. The market is not the economy, but you know, I will apologize for talking about the market because the media, the elite, is obsessed with it, that the economy as a whole can be smashed, but apparently the important thing is that the markets are healthy and that big profits for people who own shares. So the Dow was up today, but apparently futures are down more than 200 points after the market posts worst first quarter on record. Amazon and Microsoft actually ended the first quarter higher as most of the market tanked. Yes, the rich get richer. The Fed's Loretta Mester says to expect some really bad economic numbers before things get better. Oh, you mean the numbers are going to get worse? Senators push Mnuchin to guarantee oversight of $500 billion coronavirus bailout fund. Yes. Oh, CDC says diabetes, lung disease, heart disease, and smoking may increase risk of severe coronavirus. Well, how about that? That was absolutely bloody obvious right from the beginning, but apparently the CDC is only seeing fit to mention that now. Andrew Cuomo has said that his brother Chris Cuomo has tested positive for coronavirus. I believe that Chris, or Fredo, as he is better known, has been self-isolating for some days. And so we've had the hilarious interviews of Andrew by Chris. There was one yesterday which just seemed rather unbelievable. with Chris he has the two faces. There's the about to burst into tears face, and there's the surprised masturbator face, as Dan from Veep would say, or he said of Jonah. And he is cycling through these faces. Well, his older brother is indicating his, well, disgust for the questions. And so, amazingly, Chris Cuomo, who's a major figure in the media, is doing his "Mom always loved me best" routine with his brother. And, oh, you shouldn't feel bad that Mom, taught me about the Cuomo family recipes. She didn't pass that on to very many people. This is the news. This is what constitutes the news now. And Andrew Cuomo did not seem to be put out by the "Mom always liked me best" routine. And at one point, he called little brother Fredo, quote, "Mom's little helper in the kitchen," unquote. How is it glutton for punishment? Why would you initiate such a conversation in the first place? And how can you show your face in public after being called that by the governor of New York, who also happens to be your brother? But it's not all bad news. In alignment with the City of Toronto's statement, Pride Toronto will no longer host the festival weekend on June 26th to 28th, 2020. Our full statement is available online. Stay proud and stay safe, Toronto. The Pride Weekend, or the Pride Week, is North America's largest semi-public orgy. And I suspect that a great deal of health resources and money have been saved by shutting it down. But it's like they say, you have to take the good with the bad. So what is the view from the island? BC Health Minister announces 43 new cases of COVID-19, bringing the total to 1,013. There's 5.1 million people that live in British Columbia. The province also announced 5 more deaths related to COVID-19 Tuesday, bringing the provincial total to 24. That's in a population of 5.1 million, and I believe that there have been 7 deaths in 7 days, which does not sound particularly exponential to me. So Dr. Bonnie Henry, yes, another woman, the province's chief medical officer, carrying on about flattening the curve. Yes, how long is this going to go on? The health minister said that the BC government will focus on getting cancelled surgeries back on track as fast as possible whenever the COVID-19 outbreak stabilizes. Well, I hope that the health minister and the chief medical officer, I hope that they have some words to say to the families, say, of women who have died needlessly from breast cancer because their operations are being canceled. Dix added that there was a 0 chance of lifting the province's current health orders of self-isolation and physical distancing throughout the month of April. He said it was unlikely that the orders would ease up in May as well. So I live on Vancouver Island, and what is the situation there? 67 confirmed cases. 67! Got 800,000 people living here. Not 1 death, 0 deaths. 67 cases, 0 deaths. I was in downtown Victoria again today. I would estimate now, I said a few days ago that 70% of businesses are closed there. It's about 85% now. That would be my back of the envelope guess. The streets are almost completely deserted except for the homeless and the lunatics. It was rather frightening. Douglas Street which is the main street downtown, it's been low rent for quite a few years, but typically it is so busy that there are enough normal people in order such that the non-normal people, the lunatics and the druggies, etc., are not so frightening. But it's pretty frightening there. And so, despite the fact that there are fewer than 50 cases on Vancouver Island and 0 deaths, that the economy of Vancouver Island has been wrecked just like everywhere else on the basis of everyone else is doing it. So we would look silly if we did not. Toronto cancels all city-led events and festivals through June the 30th. Oh, Canada's next door neighbor is now the epicenter of a global pandemic, and there's a lot of Canadians enjoying some schadenfreude, what is happening in the United States. COVID-19 deaths at Ontario nursing home shock community. Again, an awful lot of people die in nursing homes because they're full of very old people who are unable to look after themselves. Alberta records one more death, 64 new cases. So that brings it up to 4 deaths, 4 in the province of Alberta, which has 4.4 million people, and it has been shut tight as a drum. Oh, Canada's economy is slowing even before COVID-19 hit. January GDP numbers show. I don't know that there's going to be a Canadian economy if they keep this up for much longer. Bill Blair, who is the public safety minister, asked prison parole heads to consider releasing some inmates to stop spread of COVID-19. As has been pointed out, these people are already in quarantine. Oh, analysis. Trudeau is projecting a sense of calm and continuity. Yeah, that's why he's refusing to join his wife and 3 children, because he's just so calm. Oh, the 14 days is up, but I'm going to stay in isolation, separated from my wife and children, because we're all in it together. I find it a little suspicious, the number of world leaders who have or claim to have COVID-19. It rather makes them free. It puts them in a different kind of isolation where it is considered bad taste at best to criticize their panic-stricken leadership. Yes, I wanted to talk about how the Catholic Church has become a deep green death cult. Story from LifeSite News. Vatican News pulls article calling coronavirus an ally of the earth because of environmental benefits. Earth is healing itself, wrote a Jesuit priest in the now deleted article. Someone sent me this article, and they must have moved pretty fast because I went to where it should be and it was gone. The article, written by the Jesuit priest Father Benedict Mayaki, was entitled Coronavirus, Earth's Unlikely Ally. And a secondary headline read, "The changes in human behavior due to COVID-19 virus pandemic are yielding unintended benefits to the planet." The author made no references to the tens of thousands of deaths attributed to the virus, except to say that the pandemic is a global health concern. However, there's a bright side. Earth is healing itself. In Italy, fish have returned to the canals in Venice. Less tourism and water transport have allowed the murky waters to settle. Migratory birds, including swans, have been sighted gliding through the city's waterways. He added that China has reduced its nitrogen emissions as a result of its lockdown measures to counteract COVID-19, and Hong Kong has experienced a decline in pollutants. Generally, the global reduction in air, land, and sea travel is yielding benefit for the planet by reducing carbon emissions. Well, perhaps we can go back to a subsistence economy, and then we can really ratchet down those carbon emissions. Perhaps what we need is a Malthusian die-off of billions of people. Mayaki's statements follow Pope Francis's own assertions, March 22nd, claiming that the coronavirus pandemic is nature having a fit over damage to the environment. Of course, it couldn't be God being angry with us for our sinfulness. That's not the sort of thing that anti-Pope Francis would say. Stating that, curiously, the planet hasn't been very clean for a long time. I don't know if the Pope is aware of this, but there were really heroic measures taken during the 1960s and 1970s to greatly reduce all kinds of pollution in the United States, in Canada, and many other countries in the world. For example, it used to be common for mining companies to poison the area in which they had mined for decades afterward. Well, they're not allowed to get away with that anymore. The Pope says, is it possible that this is nature's hour of reckoning with us? He really does sound like a pagan, doesn't he? There's a saying that you surely know, God always forgives. We forgive sometimes, but nature never forgives. Yeah, Pachamama, the worship of nature, fires, earthquakes, that is nature having a fit, so that we will take care of nature. After the article was announced by Vatican News on his Twitter feed, the reaction from readers was universally negative. Canon law professor Edward Peters asked, can you even begin to imagine how your words impact the tens of thousands mourning the loss of loved ones, not to mention the tens of millions suffering the destruction of their livelihoods in the wake of this disaster? Your disregard for their plight cannot be more obvious, disgusting. Shame on the Vatican News Service for publishing this. Many responses referred ironically to the recent Pachamama scandal, in what would appear to be an idol representing a pagan earth goddess. Pachamama was venerated in a ritual in the Vatican after the images had been blessed by Pope Francis. I'll just mention that this was supposedly something to do with the Amazon. Pachamama is an Inca idol, and Peru is some distance away from the Amazon rainforest. Some heroic, possibly saintly person or persons took these heathen idols from the church and threw them into the Tiber, whereupon the Vatican made heroic efforts to retrieve them and then put them back in the church. Let's see, Thomas Cole, chairman of the theology department at a Catholic prep school, called the article disappointing and pointed out that it was repeating claims that had been debunked in a National Geographic article. The claim that the environment is proving due to a slowdown in human activity is one that has been repeated in numerous articles in the past 10 days, but at least some of the claims are false. National Geographic reported that fake animal news abounds on social media as coronavirus upends life. Particularly the oft-repeated claim echoed by Miyake that swans have returned to the canals of Venice is not true. According to the article, which states that the source is an erroneous tweet using photos of swans that have long inhabited nearby canals. Claims that dolphins have come into the canals are also debunked by the article. The Guardian, which ran an article on the new visibility of fish in the canals of Venice, does not claim that the fish have returned, but only that they can be seen more easily. The publication cites environmental researcher who says that the apparent cleanliness of the canals is not due to a lack of pollution, but the absence of motorized transport, which normally churns up the muddy canal floor. So, oh yes, there was this tweet from SMCDSB, which is the official Twitter account of the Simcoe Muskoka Catholic District School Board. And Catholic schools in my country are not particularly Catholic. There's a very multiculti picture illustrating this with a black man with really outstanding hair pointing straight up, and what's presumably his wife, and some sort of half-caste children, other people, all very multiculti. It's not representative whatsoever of Simcoe Muskoka. And here's what it says. Visiting grandparents, still not okay. Kids play date, still not okay. Birthday party, still not okay. Sleepover, still not okay. Having friends over for dinner, still not okay. It's time to get serious about physical distancing. Help spread the word, not the virus. I responded, I noticed that your we heart totalitarianism list doesn't include attending mass, receiving communion, and going to confession. The sacraments are truly trivial things to the new Catholic Church you represent. I mentioned before on the show the third secret of Fatima, which was held as secret for decades by various popes, and then was supposedly revealed by Pope John Paul II, by Cardinal Ratzinger, as he was then. As soon as the official text was released, it was mocked. It's clearly not the sort of thing that would cause various popes to apparently blanch when they saw it and order that it was not to be released. So what is the third secret of Fatima? Fatima is a Marian apparition, 1917 in Portugal, between May and October. And it was 3 children, Lucia Santos and her cousins Jacinta and Francisco Marto. And there was a miracle in 1917 where the sun was said to sway like this in the sky. Apparently 100,000 people saw it. Perhaps it happened, perhaps it didn't. If one believes in miracles, well, this is one of the best attested in history. So the third secret of Fatima, the one which I don't believe was revealed, apparently it speaks of, well, heresy and devilry in the Vatican itself. And essentially, the former Philippine ambassador to the Vatican, Howard D., is saying that Cardinal Ratzinger had personally confirmed to him that the messages of Akita, this is a Marian apparition in Japan, and Fatima are essentially the same. So what does the Akita, what does it say? Well, it says that the church is going to go, there's going to be war within the church, and that the church is going to become essentially an anti-church. Let's see. The work of the devil will infiltrate even into the church in such a way that one will see cardinals opposing cardinals, bishops against bishops, churches and altars sacked. Well, that's what we've seen. The altars were sacked following the Second Vatican Council. There are many cases where tradesmen begged to save these altars, but they were ordered to smash them with hammers and the like. The church will be full of those who accept compromises, and the demon will press many priests and consecrated souls to leave the service of the Lord. Well, that's certainly come true. The Catholic priesthood and religious orders have been completely hollowed out since the 1960s. The demon will be especially implacable against souls consecrated to God. The thought of the loss of so many souls is the cause of my sadness. If sins increase in number and gravity, there will be no longer pardon for them. Well, yes. I mean, what do you call especially implacable against souls consecrated to God? Well, what would you call banning Mass, banning the sacraments? That's what it sounds like to me. Fred Simon reports, to exemplify the bond between church and state, Cardinal Tobin has locked the Newark Cathedral doors and stationed an Essex County Sheriff vehicle right out front. Absolutely astonishing. Of course, you know, if you're familiar with Akita and Fatima, not so astonishing. I'm reminded, as I'm often reminded, that the great St. John Chrysostom said that the road to hell is paved with the skulls of erring priests with bishops as their signposts. St. Athanasius said similar things, as did others. Thomas Aquinas said, it must be observed, however, that if the faith were endangered, a subject ought to rebuke his prelate, even publicly. Thus, the angelic doctor. But no, the Pope has his own magisterium now. He just makes up doctrine as he goes along. Again, from LifeSite, Bishop's ban on sacraments during pandemic violates church law. Priests can disobey, says canonist Philip Gray, the president of St. Joseph's Foundation and director of Catholics United for the Faith. Gray's response was echoed by Bishop Athanasius Schneider, auxiliary bishop of the Archdiocese of Mary Most Holy in Astana, Kazakhstan, who told the traditional Catholic newspaper, The Remnant, that a priest using discretion and following the necessary health precautions has not to obey the directives of his bishop or the government to suspend Mass for the faithful. If a priest observes in a reasonable manner all the necessary health precautions and uses discretion, he is not to obey the directives of his bishop or the government to suspend Mass for the faithful. Such directives are a pure human law. However, the supreme law in the church is the salvation of souls. Priests in such a situation have to be extremely creative in order to provide for the faithful, even for a small group, the celebration of Holy Mass and the reception of the sacraments. Such was the pastoral behavior of all confessor and martyr priests in the time of persecution. The current pope is a Jesuit. The Jesuit order is not what it was. Upcoming on the book club, I'm going to be talking about Edmund Campion, who was a noted English scholar who tossed aside all offers of preferment to join the Catholic Church. He was educated in France, just over the water. He became a Jesuit. He served in Bohemia, and then he wanted to come back to England. Now, at that time, the Jesuits knew what would happen, that they were offering the Mass to people, which was forbidden. They knew that they would be caught, they would be tortured, and they would be executed in the most foul way, and they went willingly, joyously to their deaths because of how much the Mass meant to them. But the Mass means nothing to the Catholic Church now, and it's gone, suspended. I mentioned yesterday that Bill de Blasio says that churches and synagogues that hold worship services may be closed permanently. Senator Ted Cruz tweeted, "Protect public safety, yes, but government does not have the constitutional authority to permanently close churches and synagogues." That may be part, I don't know, of the big plan, because with reason, why do we need churches anymore? Why do we need Christianity? From Tampa, Florida officials have arrested the pastor of a megachurch after detectives say he held 2 Sunday services with hundreds of people and violated a safer at home order in place to limit the spread of the coronavirus. According to jail records, Pastor Rodney Howard Brown turned himself into authorities Monday afternoon in Hernando County, where he lives. He was charged with unlawful assembly in violation of a public health emergency order. Bail was set at $500 according to the jail's website, and he was released after posting bonds. Not only did the church comply with the administrative order regarding 6-foot distancing, it went above and beyond any other business to ensure the health and safety of the people, said a statement from Liberty Counsel, Howard Brown's law firm. Contrary to Sheriff Cronister's allegation that the pastor was reckless, the actions of Hillsborough County and the county, that's a mistake there, and the Hernando County Sheriff, a mistake in the original text, are discriminatory against religion and church gathering. Yes, pastors are being arrested in the United States for holding Christian religious services. Who thought that this would come so quickly? The elite does not like religion, unless it's gay religion. Pete Buttigieg. As I predicted some months ago, you're going to be hearing this line more and more. The only good Christian is a gay Christian. So a New York Times opinion piece, and this is again from the invaluable LifeSite News, has suggested Christian supporters of President Donald Trump have hindered the U.S. response to the coronavirus pandemic. Catherine Stewart, author of The Power Worshippers Inside the Dangerous Rise of Religious Nationalism, published a piece in the New York Times on Friday, which was originally headlined, "The Road to Coronavirus Hell Was Paved by Evangelicals." Oh, so we can blame Trump and the evangelicals for coronavirus, even though these are the same people who, barely over a month ago, were telling us there was nothing to worry about except for stigma. So these people will get to be smashed. And, you can add that to the key bono category. That headline has now been changed to "The Religious Right's Hostility to Science is crippling our coronavirus response, with Stewart expressing her approval of the change, describing the new headline as more precise. The text immediately below the headline asserts that Trump's response to the pandemic has been haunted by the science denialism of his ultra-conservative religious allies, with Trump pictured smiling at a prayer event with evangelical Christians. You remember when the media was telling us back in 2015 and 2016 that one of the reasons why Trump didn't have a hope was because religious people would never vote for him because he was a notorious roue. Well, they were absolutely wrong about that. And here's a example yet again, although I don't recall these people apologizing for this wildly wrong prediction. I don't recall any of them losing their perches in the media because of it. Stewart takes, let's see, Donald Trump rose to power with the determined assistance of a movement that denies science, bashes government, and prioritizes loyalty over professional expertise, before informing readers that in the current crisis, we are all reaping what that movement has sown. You get that? The New York Times is saying that evangelicals are enemies of the people. Well, that's tricky, because when you're talking about the people, a lot of the people in the United States are evangelicals. I guess what? They're the enemies of truth. They're the enemies of goodness. Stewart takes aim at a handful of Christian churches who have continued to encourage congregants to attend, and according to the article, appear to be spurning so-called social distancing recommendations. One of the church leaders mentioned, we just talked about Rodney Howard-Browne. Paul Boyce, writing at the Daily Wire, points out that one could easily cite such examples on the left, pointing out a tweet from New York Health Commissioner Orixis Barbo, that's quite the name, back in February, encouraging people to attend the Lunar New Year parade in New York City's Chinatown and not change any plans due to misinformation spreading about coronavirus. Orixis, I have no idea if that's pronounced. Barbo, Barbot, it just appears to be, yes, another woman. And once again, we were told, forget about the disease, not a problem, real problem, stigma. So let's talk about less serious matters, or let's talk about, well, celebrities, and then I'm going to talk about the last episode of Better Call Saul to round up the program. Yeah, the bonfire of the celebrities. This is a piece from DNYUZ. I don't really know what that stands for, if it stands for anything. And this article doesn't seem to have a credited author. America is in crisis, but the celebrities are thriving. They are beaming into our homes, reminding us to stay indoors and stay positive, and we're all in this together. When I watch their selfie public service announcements, I find my attention drifting to the edges of the frame, to the understated wall molding visible behind Robert De Niro's shoulder, to the craftsman beams on Priyanka Chopra's balcony, to the equine wallpaper framing Zoe Kravitz's crackling fireplace. Again, I am more than a little suspicious that all of these celebrities have coronavirus. Oh, and they're also dutifully social isolating. We're all in this together. You know that it's real because celebrities are suffering. It's not as if, the celebrities could have been invited, to take part in this in order to, they call them influencers, in order to influence compliance with what is nothing less than a totalitarian regime. Staying home is my superpower. Oi, Gewalt. Wonder Woman star Gal Gadot reported from her walk-in closet. Ryan Reynolds urged his fans to work together to flatten the curve from within his rustic loft. And Ryan Reynolds, he is from Vancouver, I believe, perhaps West Vancouver. How did that guy get to be a leading man? How did he get to be an action hero? He's weird looking. He's got gay face. He certainly does not look like a tough guy, but apparently they can turn anyone into a superhero. That didn't work with Seth Rogen, though, did it? They were just pushing a little too far there. I guess Ryan Reynolds is sort of a acceptable modern male. Let's see. When Jennifer Lopez posted a video of her family sheltering in the backyard of Alex Rodriguez's vast Miami compound, the public snapped. "We all hate you," was one representative response. Well, to repeat, I've been thinking for the longest time, about 15 years, that the celebrities, there was going to be an enormous backlash against the celebrities and they had better moderate their behavior. Of course, they didn't moderate their behavior. It just became worse. And so what was going to stop it? Well, maybe this will stop it. Maybe the tide has turned against the celebrities. Among the social impacts of the coronavirus is its swift dismantling of the cult of celebrity. The famous are ambassadors of the meritocracy. Oh, really? Jennifer Lopez doesn't sing on her records. Do the listeners, the viewers of this, do they know this? She doesn't sing on her records. They represent the American pursuit of wealth through talent, charm, and hard work. But the dream of class mobility dissipates when society locks down, the economy stalls, the death count mounts, and everyone's future is frozen inside their own crowded apartment or palatial mansion. The difference between the two has never been more obvious. The guillotine 2020 hashtag is jumping. As grocery aisles turn bare, some have suggested that perhaps they ought to eat the rich. Yes, this is what's called a pre-revolutionary situation. So when Pharrell Williams asked his followers to donate to aid frontline responders, they virtually grabbed him by the pants and shook him upside down, telling him to empty his own deep pockets. Kristen Bell and Dax Shepard have been outed as landlords. As Ellen DeGeneres lounged on her sofa, video chatting with famous friends, the comedian Kevin T. Porter solicited stories from service workers and Hollywood peons who had experienced run-ins with DeGeneres, whom he called notoriously one of the meanest people alive. CoverGirl. She was a CoverGirl. Along with that horse-faced actress, 30 Rock. She was excellent as a comedic actress. I'm not all that familiar with her singing. But Ellen DeGeneres and then Queen Latifah, how much makeup do lesbians buy? Anyway, Ellen DeGeneres, when she was doing these ads, she looked like an elderly raccoon. This is what America's women supposedly aspire to look like Ellen DeGeneres. For some years now, Ellen DeGeneres has been, frightening looking. People are going to riposte that I'm frightening looking as well. I am not a universally beloved talk show host. I speak to a rather small audience who is, I suppose they're not aspiring to be me. That would be a very stupid aspiration in any event. It must be a very hard time to be so famous. Celebrities are not among the very wealthiest Americans. Lopez's reported net worth is a fraction of a percent of Jeff Bezos's, but they are the ones who are tasked with liaising with the general public, offering vicarious access to their lifestyles. Celebrity culture glorifies them not just for their performances or personas, but for their wealth itself. Their blowout child birthday parties, car collections, plastic surgeries, and property ownership. From lifestyles of the rich and famous to My Super Sweet 16 and Keeping Up with the Kardashians, the ability to watch or hate watch the spectacle of excess has functioned as a bizarre appeasement for inequality. I remember Charlie Brooker some years ago reviewing My Super Sweet 16. I was not familiar with this show, which he called an Al-Qaeda training video. And on one of the clips that he showed, this girl who was turning 16, that her mother inadvertently blurted out that she was getting some sort of spectacular car for her birthday. I don't know, like some $60,000, $70,000, $80,000 car. I don't know, maybe it was an Audi or something like that. And so this girl starts screaming at her mother that she hates her and you have ruined my birthday. And I thought, well, I guess this is an Al-Qaeda training vehicle. The compact rests on the celebrity's ability to seem to move easily between the elite and the masses, to be aspirational and approachable at once. And under normal circumstances, they are accustomed to receiving accolades for using their platforms to raise awareness in the service of bland initiatives for the public good. but our awareness has never been so easy to rouse and misuse. Celebrities have a captive audience of traumatized people who are glued to the internet, eyes darting toward trending topics for clues to processing the unimaginable horrors looming just outside. Stunts like a Gal Gadot's crowdsourced famous person cover of John Lennon's Imagine are tone deaf in more ways than one. Most of these people cannot even sing. DeGeneres apparently is going stir crazy from having to stay inside her enormous home. Katy Perry has lost track of the days she spent inside her enormous home. Madonna has elevated celebrity delusion to a kind of performance art in a series of oddly professional Instagram videos suggesting a perhaps dangerous concentration of staff members in her home. She can be seen undergoing a bizarre healing procedure at her personal health clinic and bending over a typewriter in a kimono, pontificating about the social effects of the virus. For Madonna, performing for the public and holding fans in her thrall is yet another luxury gone for now, she says in one video. How very sad. In its place is the disturbing sensation of normalcy. The audience in my house is not amused by me, she says later. And she concludes that COVID-19 is the great equalizer. You remember I spoke about it, where she said that COVID-19 does not care how old you are. COVID-19 cares very much how old you are. Is Madonna really that stupid, or does she not want to offend anyone by, naming the known truth that people who are very old are far more likely to die today or tomorrow than, most people? So Britney Spears has emerged from this crisis as the rare celebrity to tap into the need for radical social change. Spears recently posted a bright yellow manifesto on Instagram from the internet artist Mimizu. We will feed each other, redistribute wealth, strike, it reads. Communion moves beyond walls. She added 3 red roses to the caption, an ambiguous symbol reflecting either her support for the Democratic Socialists of America or perhaps her simple affinity for floral emoji. Spears is an unexpected figure to lead us through quarantine, but a fitting one. She's been held under a conservatorship for 12 years, her movements and finances controlled by her father and overseen by the courts. When she posts about finding community in social captivity, she knows what she's talking about. Well, I don't know about that. I feel sorry for the woman. She's clearly not very bright. She has been exploited for the whole of her life. And there is this shocking situation in California where her conservator is also her manager. So she has to work herself to death in Las Vegas, week after week after week after week. I'm sure the poor girl would very much like to return to small town Louisiana, but it doesn't appear as if she's ever going to be allowed to do that. So Better Call Saul. Always interesting music choices in that show, and one of the choices last night was something by a woman called Ima Sumac, who, that wasn't her real name. I guess it's spelled Y-M-A. Her real name was Zoila del Castillo. She was famed for her vocal range, which was more than 4 octaves. And yes, I suppose she is much beloved these days by connoisseurs of what's called exotica. So that had that going for it. So we were talking last week about this wedding proposal made by Kim to Jimmy. And, well, it was real. Some people doubted it. And it turns out that it was completely transactional. That she is worried about being arrested for what she has done, just as she is worried about Jimmy being arrested for what he has done and what they have often done together. So our spouses cannot be compelled to testify against each other. Huel, who is kind of the male minder, because he starts out as Jimmy's male minder, bit of factotum. He was in great form last night. That he simply wasn't feeling this wedding. But there's no exchange of rings. Well, you know, it's not that kind of wedding. So he thinks it's a shotgun wedding. And no, he says you should do it right for the rugrat. And Jimmy says there's no rugrat. And Jimmy explains the purpose of the marriage, and Huell had offered to steal a half-a-carat ring from a clerk in the courthouse so that they would have a proper wedding ring. Now, Huell is clearly an amoral man, but he seems like a good-hearted one. But no, he was one of the witnesses at the wedding, and you see him, very funny scene where he's just shaking his head and pursing his lips. This is not marriage as he understands it. So we're in the 5th season. This was episode 7 of season 5. And I guess we're almost at the point where, you know, Saul Goodman has arrived in all his glory. He ended the show with a rant, rather reminiscent of the film Network. The show has a movie reference every week. And poor Howard Hamlin. Howard is a bright fellow. And Howard had discovered that he figured out that it was clearly Jimmy who had seriously damaged his car with a bowling ball. And also it was Jimmy who had hired 2 street hookers to barrack him at lunch, suggesting he was the kind of man who not only paid for street hookers, but in fact did not pay them and had to be dunned for this, which was a very nasty thing for Jimmy to have done. Jimmy has become a very nasty character. Indeed, Howard is the only character on the show who is not, well, nasty and not a creep. Jimmy clearly blames himself for his brother's death, but he is projecting this onto Howard. And I guess this is, you know, you need some sort of motivation. We have seen Jimmy directing the Drama Kids last week, and he was directing Lalo this week. He's clearly a frustrated director or director-producer, you know. And so he needs to play a role. And Saul Goodman is a role. Now, we have a picture, which I put up on my Twitter feed. It's a teaser for this show. A very clever use of the camera and a reflective surface to show a bifurcated man. You know, he's Jimmy McGill, but he's also Saul Goodman, although the Jimmy McGill part of him is, you know, quickly disappearing. But of course, later he will become Gene, so he will become trifurcated. So Jimmy wants to be rich, but more than that, he wants to be celebrated. He wants to be like his brother, his late brother Chuck, only he wants the adulation to be public. You know, he's talking about press conferences and the like. He wants to be famous. And if he'd gone to work for Howard, well, the chances he would have made a very good living, but the chances of him becoming famous, not too good. And Lalo, who continues to impress, the actor playing him, he's been framed. Well, he's been framed for something that he did, but he's in prison and he wants out, and the cartel wants him out. And when Jimmy is visiting him in the lockup, he sees the monogram on his briefcase, and JMM, which stands for James Morgan McGill. But Jimmy lies and says that it stands for Justice Matters Most, which Lalo thought was very amusing indeed. And so he says to him, would you like to be a friend of the cartel? And Jimmy thinks about it. You don't think very hard. Well, yeah, especially since you should change your motto to just make money. And Jimmy has already begun spending some of that imaginary money on a mansion for him and Kim. I was thinking about this, you know, being a mob lawyer. You make a lot of money making a mob lawyer, but there's a serious possibility that you are going to end up dead or on the run permanently or spending decades in prison. What you need to succeed as a mob lawyer is political protection. And there's been no indication on Better Call Saul that the Mexican cartel actually does have political protection in the state of New Mexico or anywhere else in the United States. Someone responded to me on Twitter yesterday saying that Jimmy and Kim have both become annoying. Yeah, I suppose they have. You know, Kim Wexler is a clever girl, and I like clever girls, but there's clearly something broken in her that would lead to this misalliance with Jimmy, especially since, you know, she knows everything about him now. She knows all about his character. We were reintroduced to Peter Schuler of Madrigal, and there was a great scene where the various CEOs of the restaurant chains owned by Madrigal, were giving their pitch and talking about how well they had done, and some great acting from Gus Fring, Giancarlo Esposito, that he's so controlled, you know. But then he puts on the show. Excellent actuals from Los Pollos Hermanos. Also, a new addition to the product line. Curly fries, you know, with a difference, with, you know, authentic New Mexico flavor. And he just seems so genuinely delighted saying this. It, you know, it reminded me of that joke, that old joke from Get Smart from the 60s, a joke that was repeated in almost every episode, which made it even funnier, where Maxwell Smart said, if he'd only used his genius for good instead of evil. Gus is very good at running a fast food chain. It's as if he was born to it. But of course, you know, just as Jimmy is looking for revenge for being slighted by his brother and then his brother's death, Gus is looking for revenge for the horrible treatment, for the murder of his partner in Chile. Well, it didn't happen in Chile. It happened in Mexico by the Salamancas. And we had a return of Lydia Rodart Quayle, played by a lovely Scottish actress. Here's a story about her. That when she was approached for the part, she was asked, you speak German, right? And she did not speak. The actress's name is Laura Fraser. She does not speak German, but she said, yes, I speak German. And then set to learn German as quickly as possible. And there is a life lesson there. That as a general principle, if your boss asks you, can you do this? Say yes. This worked out for me some years ago. I needed a job, and I was working part-time. And I wrote a report, and the editor-publisher of the magazine confessed to me that he was fed up with the head of production. I don't know. He'd given him an ultimatum because one of the editors was so late with his copy, it was causing tremendous problems. Also, one of the editors was doing the final inspection of the magazine, and he didn't realize that a page had been repeated, which caused me some difficulty when I was reading through the magazine before I started working there full time. And I was in a pub, and I'd had a beer, and I was eating my hamburger and reading the magazine. And wait a minute, this looks familiar. This looks familiar. Turn the page. It's the same pay. No, that can't be right. Well, it was right. But in any event, so the editor publisher says to me, do you know a lot about computers? And I said, yes. Yes, I do. And what I knew was DOS 5. That's how long ago it was, and Microsoft Word. Do you think that you could handle being the production editor of the magazine? Yes, I said. Well, the first weekend of my regime, now I didn't, the real expert in this was this fellow named Dave, who saved my life. I was in charge, and I set the standards, and I did a fair amount of layout corrections and putting photos in and the like. But the first weekend was an absolute nightmare. We were up, literally worked through the night, and at 2 o'clock in the afternoon, the magazine still wasn't done. And it was one of those situations where you think, I'm dead, aren't I? I'm dead and I'm in hell. Because how can it be 2 o'clock in the afternoon and we still haven't finished the magazine? Well, it finally got finished, and the next week went faster, and the next week faster. That is to say, I learned how to do it, and I actually got pretty good at it. So that's the life lesson. If people offer you a challenge and you're looking to get ahead, then say yes. Now, of course, Kim Wexler was not in Breaking Bad, so something happened to her, because Saul Goodman certainly was. And I guess we're all going to be worrying about Kim. So what are the choices? That she, disappears? Or she gets killed? Well, I guess we'll find out. A really good episode of Better Call Saul last night. So let's look at the chat, and we'll finish it. Prague has a lot of Israel's on roots tours, says Half Galatian, to see the Jewish quarter, the old synagogue, etc. It's a big tourist site. Let's see. Can we please stop talking about LF? Yes, this is my show. Why aren't we talking about me all the time? Me. Yeah, okay. So, yes, the chat has a tendency to diverge radically from what's being spoken about. KMG is a throwback to a bygone era and gives us all a wistful sense of comfort, says MCT. That is a high praise. Thank you. Very kind. Too kind. Don from Beyond says Kevin's voice and unique delivery style, curiously attractive and addictive, at least to me. Again, too kind. And the new Cadillac commercial could benefit from KMG's voice, the lipped one. Well, yeah, maybe I should look into that. I've spoken about this before. My voice is melodious and mellifluous, but it lacks power. That's the problem with my voice. You're not going to get a lot of volume, sustained volume. I took acting in school from grades 7 to 12, actually. And I appeared in several plays. I was the lead in our grade 12 play, a version of Hansel and Gretel. I played Hansel. Just a quick story about that. We did a little tour of elementary schools in the region. And one of them was a school at which 3 of my brothers and sisters went to. And so when we are just about to enter the witch's house, the children, the younger children, the 6 and 7-year-olds, they started shouting from the audience, no, don't go in, don't go in. And I heard them and I noticed them when I was on stage, and I thought, this is the best review possible. I have actually persuaded a bunch of children that what is happening here is real. But one of my brothers told me that these same children, the children in grades 1 and 2, got a sound ticking off from the teacher the next day. Teachers crushing children's imaginations since forever. But no, I took several years of acting at school, and they didn't teach me anything technical. They didn't teach me anything about voice, about projection, about movement, nothing. It was a big rip off. But I don't know. Some people like my voice. So I'm going to wrap up the show here. I will be back tomorrow, usual time, 4 p.m. Pacific, 7 p.m. Eastern time. And if you like the show or any part of it, I would greatly appreciate it if you would click on the like button and subscribe to my YouTube channel. If you would wish to donate, my PayPal address is kevin_grace@hotmail.com. And I will see you all tomorrow afternoon or tomorrow evening, depending on where you might be. And I hope you all have a lovely evening. Good night.